prostate-specific membrane antigen, or PSMA, is a transmembrane protein that's highly expressed in metastatic castration-resistant prostate cancer. And lutetium PSMA is a radioligand that delivers a beta radiation particle to PSMA-expressing prostate cancer cells and the surrounding tumor microenvironment. The VISION trial was a recent phase 3 randomized study that was presented earlier this month at ASCO and published in the New England Journal of Medicine, of men who had received at least one prior androgen receptor signaling inhibitor and 1 or 2 taxane chemotherapies, who were randomized to standard of care treatment or the addition of lutetium PSMA. One important point is that men eligible for the study had to have a gallium PSMA PET scan with a positive positive lesion on PSMA PET and no negative lesions on PSMA PET. And this accounted for about 86% of the men who underwent a gallium PSMA PET scan in this study. Excitingly, the study met the co-primary endpoints of prolonging the median radiographic progression-free survival by a little over 5 months and prolonging the overall survival by 4 months. And this is huge for our patients with advanced prostate cancer. These are men who are refractory to chemotherapy, refractory to hormone therapy, and really don't have many great standard of care options left. So this is a huge unmet clinical need. And now that we have lutetium PSMA as an additional life-prolonging therapy for these men is huge. And finally, just want to mention there are several ongoing clinical trials looking at lutetium PSMA in other disease settings, in oligometastatic prostate cancer, metastatic hormone-sensitive prostate cancer, and in combination with chemotherapy or immunotherapy. And so I think it's going to be really interesting to see down the road how we end up using lutetium PSMA to derive the most benefit for men with prostate cancer. This is a really exciting area. I think molecular imaging tools have the potential to transform how we diagnose and treat men with prostate cancer. Generally speaking, there are 2 types of molecular imaging. There's metabolic agents and receptor targeting agents. The most commonly used metabolic agents in prostate cancer are flucyclovine PET and choline PET. The new kid on the block is gallium PSMA PET. This recently received FDA approval in December 2020 and targets the transmembrane PSMA protein, which is highly expressed in prostate cancer cells. These molecular imaging tools have several potential uses across the prostate cancer disease spectrum. In men with localized or clinically localized prostate cancer based on conventional imaging, you can imagine using these molecular imaging tools for detection of occult metastatic disease. Likewise, for early detection of metastatic disease in men with biochemical recurrence following definitive local therapy. And these molecular imaging studies clearly demonstrate a greater ability than conventional CT or bone scan for detecting metastatic disease in men with prostate cancer. But I would caution that we don't have long-term data yet to guide how we should change management based on findings on these molecular imaging studies. This is going to be a huge area of interest for the field over the coming years, and I think will ultimately transform how we treat men with certain stages of prostate cancer. In the metastatic setting, as I mentioned, we now know that men with gallium PSMA PET positive disease, that the addition of lutetium PSMA prolongs survival. But beyond that, I think in the metastatic setting, I think these molecular imaging studies could really help us develop a more nuanced understanding of advanced prostate cancer subtypes and guide precision medicine. We now know from the VISION trial that 14% of men with advanced prostate cancer have PSMA PET negative disease. And there's data that tumors that have low or absent expression of PSMA or have greater expression of genes associated with neuroendocrine prostate cancer. So I think, these observations raise some really interesting questions, specifically for the PSMA PET negative cohort of advanced prostate cancer. And, I imagine over the coming years, we're going to have integrated analyses of molecular imaging with tumor molecular profiling that will be really informative and hopefully advance precision medicine and improve how we care for men with advanced prostate cancer.